2025 World Health Day. The World Health Organization has enjoined the federal government and other stakeholders to work collaboratively towards reducing the high maternal neonatal mortality deaths in Nigeria. The WHO country representative in Nigeria, Dr. Walter Kazadi Mulumbo, made the call on Monday during the Walk the Talk awareness exercise organized by the organization in collaboration with the Federal Ministry of Health and Social Welfare. The Director of Planning, Research and Statistics, Dr. Camille Shoretire, said Nigeria still faces significant healthcare challenges, including a high maternal mortality rate. He added that the government is working hard to address healthcare challenges and achieve the goal of reducing maternal and neonatal mortality. Tonight, joining us as we discuss the theme of this year's World Health Day 2025, Healthy Beginnings, Hopeful Future, is Dr. Salma Anas, Special Advisor to the President on Health. Dr. Salma Anas is a public health physician with almost 30 years' experience in public health program and interventions at both national and international level, with a passion for improving access to quality reproductive, maternal, newborn, child, adolescent, and elderly health plus nutrition services, including sexual and reproductive rights, as well as gender-based violence. Thanks a lot for joining us this evening, Dr. Anas Ibrahim. Thank you.
Thank you very much, and good evening, Nigerians.
Good evening to you.
So yesterday, happy World Health Day.
Absolutely, absolutely. Yesterday was World Health Day, and you know, every year the day centers on a different theme in an effort to increase awareness and inspire global action. But overall, it highlights the need for international cooperation in addressing health issues and serves as a reminder that overall well-being depends on good health. For us here in Nigeria, how significant is this year's theme?
Thank you very much. Yes, this is very relevant to us in Nigeria. And by the way, this is the first time since 2005 that the world is celebrating World Health Day with specific focus on maternal and newborn. So we are very excited in Nigeria because it is very timely, it is appropriate, and it also aligns fully with the aspirations of President Bola Ahmed Tinubu, the Renewed Hope Health Agenda. So it is a pillar in our agenda because we are still, I can say, work in progress in trying to reduce death associated with pregnancy, childbirth, and postpartum, and also to improve survival of children. If you look at our recent indices, you can see that Nigeria, we are still lagging behind. We are making very slow progress. The newborn death is still very, very high. And then the maternal death, we are not where we want to be. So we welcome the idea because it gives us an opportunity to step up action, especially on awareness creation, on also mobilization of more investment, and also aligning all stakeholders towards that responsibility of acceleration of reduction of maternal death and overall improvement of in the well-being of women's health and also well-being of women, as well as improvement in child survival. So it's quite appropriate and it's at the right time. It's going to be a one-year event that we're going to be commemorating and also creating awareness.
But back here in Nigeria, is there really something to celebrate? You know, having had several conversations with Professor Ali Pate, who is the coordinator Minister of Health, I mean, this man has set a high target for himself and his team in the provision of health infrastructure nationwide. And I know there's been a lot of progress from where we were before this administration came on board. Also having spoken with Dr. Kelechi Ohiri of the NHIA, and according to him, Nigeria's insurance structure, both publicly and privately led, now covers about 18 million, and there is a firm commitment to increasing that number. However, Nigerians are worried about the country's continued failure to meet the Abuja declaration of allocating 15% of the national budget to healthcare. So is there really something to celebrate for us here in Nigeria?
So yes, while we are still celebrating modest progress that have been made in the space, especially in the space of improvement of maternal and child health, for instance, the expansion, as you said, of the coverage of vulnerable people through the Basic Health Care Fund and the Vulnerable Group Fund by President Bola Ahmed Tinubu, I think this is a cause for celebration and more focus on strengthening of our primary health care facilities, where women will have access. You know, access is a major challenge, it's a major barrier to quality healthcare services. So with that, women will have more access because it is expected that at least women will have access within 30 minutes walk to a functional primary health care facilities. And this is already going on across the country in all states of the Federation. But what is most important that I think we are celebrating is the realization that we need to do more, and much more is happening at the moment, not just in terms of investment, but across board, across all the stakeholders, not only government, but also private sector, and then especially communities, traditional institutions, and religious leaders. So what we have seen recently, you've talked about the budget increment. Of course, President Bola Ahmed promised to increase the budgetary allocation. And in the last 2 years, we have seen a modest increment in the budgetary allocation for health. And significantly is also going in to strengthen systems and to improve access to health services for women and children. So I have talked about the Vulnerable Group Fund, which is going to cover quite a lot. So the recent indices, the recent survey of the National Demographic Health Service showed that 33 states of Nigeria, of the Federation, have the highest burden of maternal death and poor survival of children in 172 local governments. A lot of action and focus are currently targeting those 172 local governments in terms of demanding also for services as well as the supply side, where we will have much more facilities being strengthened to provide emergency obstetric care as well as the basic obstetric care, as well as also making linkages between that level of care, referral linkages between that and also the secondary level of care, as well as secondary level. So, but you will agree with me, because this is the topic that a lot is also being said by the Ministry of Health, and efforts are ongoing by the Honorable Minister in capacity building. It's the area of human resources for health. So a lot of capacity building efforts have gone in to build capacities of healthcare, frontline healthcare providers at the lowest level, and this is currently ongoing. So with all those efforts, jointly, and also efforts from community aspect of it, are trying to address the aspect of the socio-cultural, norms and the ways we do things in terms of our religions, also our cultural predispositions. It will add up together to, we are very hopeful that it will yield a better result. And that's why the team is talking about the healthy beginnings, and then hopeful future, because the effort is now on the mothers and also on the babies, ensuring that we have a better beginning, we have a good beginning, even pre-pregnancy, during pregnancy, and then during delivery and post-delivery. The same thing also applies to the babies, right in utero before in pregnancy, and then immediately around birth, which includes the first 5 years of life.
So, Dr. Anas, before we streamline this conversation to maternal health and why it is important that no woman dies, in this part of the world, no woman dies at the point of child delivery, in order to provide a solid basis for future generations, this theme of this year emphasizes the necessity of better healthcare services. Are there some golden rules for a healthy life? If there are, please share with us.
So I didn't get that right, but I guess I'm supposed to speak about the healthy life. Yes. So the healthy life, healthy beginning starts from the mothers.
So generally speaking now, are there some golden, can you hold on, Dr. Anas?
Period.
Yes, I want you to get the specificity of that question. Are there some golden rules for a healthy life? If there are, please share with us.
Did you say golden rule for healthy life?
Yes,
there are.
Yes.
Yeah, yes, of course, definitely. So as I said, it's a life cycle. It's a family life cycle that starts immediately, even pre-pregnancy, where you prepare the girl child. And that is where the aspect of sexual and reproductive health comes in. So education is very important. We need to educate parents, we need to educate families about the upbringing of a girl child. What are the expectations, even when a girl is growing up as a teenager? There is need for education. And a lot of efforts have gone in Nigeria, which we need to continue and revitalized, because it's not been implemented in most parts of the state because of issues of misconception. So there is need for integration of sexual education or family life education into our education curriculum. And I'm very glad that we've started that discussion with the Honorable Minister of Education to revamp that, especially at the secondary level of education, even up to the tertiary level of education. So we prepare our young ones, not only the girls, but also the boys, about issues of reproduction, issues of sexuality. And then it goes on immediately during pregnancy. There is need for early attendance at the antenatal clinic, early detection of illnesses, screening, and all that happens at that time. So there is need for a woman to report immediately to an antenatal clinic within her, any facilities that is very close to her, and register. And that is very important. And then the education continues there during the antenatal clinic period, which is throughout the lifespan of the pregnancy. And then diseases are detected. The well-being of the mother is also being monitored, as well as that of the baby is also being monitored. Mother receives all the necessary vaccinations as of that time, and is also being prepared for a safe delivery. Then at the point of delivery, which is a critical point that is also necessary, that we must educate and ensure that all necessary requirements are there in terms of human resources, in terms of the infrastructure, in terms of privacy, confidentiality, not just medicines and supplies, but everything is available, and also the security of the mother, so that she is delivered in a safe environment, and also delivered by a skilled birth attendant. And this also has to do with a highly skilled health provider, which cut across depending on the facility. It could be a medical doctor, a nurse, a midwife, or a community health worker, or a community health extension worker who has been trained and have the requisite skills to deliver the baby. So immediately after that, it continues postpartum care of the mother, which is also very important. And then continuation of health care for the baby, which starts at that point, immediately within an hour of delivery, where the expectation is to ensure that the baby is fed with the breast milk, which is natural. And that is the first vaccination, and I may say the first immunization for the baby. It embodies and has everything that is required for the baby, including the colostrum, which is the first meal for the baby. It has an antibiotic, it's a vaccine, so that is the first that should be initiated within an hour of delivery. And then immunization continues, because most of the diseases, that kill our children are preventable. So we enroll them, and they immediately start immunization right at birth, and that continues. And then nutrition also immediately at birth, and that continues. And then exclusive breastfeeding continues for the first 6 months, and thereafter up to 2 years, until the mother decides to wean at about that 2 years. And at 6 months, continued with complementary feeding. So we've talked about the issue of nutrition is also very significant. The first 1,000 days, of a baby is very important. It's very important, not just for physical development, but also for the brain development of the child. So emotionally, psychologically, and otherwise, it's very important that the first 1,000 days of the baby is well nourished with a balanced diet to ensure that we have a healthy future. And that's why we tie it to the healthy future for national development.
All right, so if we're very concerned about delivery in a safe space and skilled personnel who take delivery of these babies, we must also talk about the structure of the healthcare system, health management system in Nigeria. I remember the president unveiled a plan for massive investment in health coverage. What promise does this hold for the country?
So this is what we should, part of the celebration, which we celebrate, because the president has demonstrated highest level commitment and has also translated into concrete actions in the last few years in the health sector. So investment has been made in the health sector right from the grassroots level. A lot of investment in the primary healthcare system strengthening, because this is the basic, this is the first line, this is the platform that is expected to ensure access to more than 70% of Nigerians. Because 70% and above of Nigerians, the basic needs for public health is at that level. Basic healthcare needs, basic medical supplies, those are the things that can be issues that can be handled at that level. And a lot of investment has gone into it. And I've given examples with the Vulnerable Group Fund and also the Basic Healthcare Fund. And these are just contributions of federal government. Similarly, it's also ongoing at the subnational level by the governors in some respective states to align with the aspirations of the president. So at that level, what is happening is to ensure that the basic minimum are available in terms of basic emergency obstetric care, basic minimum medical supplies, and then education, health promotion, awareness campaign, immunization activities are made available. In fact, it has now been including mental health and a lot of psychological support, for women at that level. So this is the package which is beyond what we were having in the past before. And then at a higher level is to ensure the linkages, as I said, at the secondary level of care. So the approach is to see that of this administration is to ensure that we deliver an integrated and comprehensive healthcare services, at all levels. So at that basic level of the PHC, which is expected to be at least one functional PHC, at most two functional PHC per ward in every local government of the Federation. And that is the vision that we are driving to achieve by 2027. And then connected and linked to a secondary level of care. That is a general hospital, or that is a secondary level of care. So that structure is owned by the state government, and we work together with the state government to provide strategic support and strategic guidance in terms of what are the expectations, also capacity building and monitoring and evaluation to ensure that the services are also available of high quality and referral systems are also well established between the primary healthcare and the secondary level. But that takes us to the highest level, which is the tertiary institutions. Owned by the federal government of Nigeria, which is managed and coordinated by the Federal Ministry of Health. So each state of the Federation currently, we have seen massive boost or improvement and establishment of additional tertiary institutions in the country. And these are teaching hospitals and also federal medical centers. When President Bola Ahmed Tinubu, he has increased and committed to the establishment of additional federal medical centers that will be able to provide highest level care delivery to complicated illnesses and also research in addition to training of healthcare providers at that level. So all those are connected. They are not expected to work in silos or as a standalone. Okay. So the tertiary institutions serve as a resource base in every state of the Federation that supports and provide provide guidance and capacity building, and mentorship to the secondary level of care and also to the primary healthcare level in every state of the Federation. So this is the structure that exists in the country. And efforts are also going on to strengthen specialized healthcare services in the country, such as orthopedic hospitals, neuropsychiatric hospitals, even fistula hospitals for women have also currently been strengthened, and capacities are being developed to ensure that vulnerable women also have access, that are victims of fistula in the country, across the country in different parts, have also not left behind. So those are all aimed towards ensuring that we attain universal health care coverage and no one is left behind.
Right. So I do not know if there is a word. And according to reports gathered from UNAIDS 2023 data, 140,000 children aged 0 to 14 are living with HIV in Nigeria, with 22,000 new infections and 15,000 AIDS-related deaths recorded annually. How committed is the federal government to scaling up prevention, testing, and treatment services across the country?
Yes, thank you so much for bringing on the issue of HIV/AIDS in Nigeria. And I can comfortably say that this is an area that Nigeria should celebrate. It's a success story because if you look at the whole entire scope of the HIV/AIDS trend in Nigeria, we have witnessed massive decline in HIV/AIDS, the new infection. If you look at the trend from 1999, where we have above 10%, and today we're talking about less than 2% prevalence of HIV/AIDS in Nigeria. And then the people living with HIV/AIDS, that are on treatment are more than 95%, and those that have been cancelled are receiving treatment and above that. So this is success stories that we should celebrate in the country. On the other hand, the weakest link is, as you said, transmission of mother-to-child transmission of HIV from mothers that are infected to their unborn children. This is still happening in the country, and then this has also affected the number of pediatric children that are supposed to be on treatment. We've not reached the target. So I can say that because the whole of this is within the scope of reproductive, maternal, newborn, and child health, we are making drastic efforts to ensure that we strengthen access to maternal, newborn, and child health services. Because, if, for example, if an infected woman with HIV, she's not aware she's infected, she'll only know she's infected if she enrolls, you know, in an antenatal care clinic where she'll be screened, as I mentioned earlier. Part of ANC is to screen for common diseases, including HIV. And that is the first time that the woman will know of her HIV status and then begin to access value. So the good thing we've done today is to integrate HIV testing and counseling within our primary health care facilities. And even antiretroviral treatment are also being uptake at our primary health care level. But much efforts are currently ongoing to ensure that we address the weakest link in the HIV/AIDS scope of work, and that is the transmission of mother to child, you know, of HIV. A lot of work is currently ongoing to create awareness, to mobilize women to attend antenatal clinic immediately they are aware they are pregnant, and also to get tested for HIV and be counseled for it. If they turn out to be positive, they are enrolled on treatment that will prevent, and the drugs are readily available. Nigeria is benefiting from the drugs. The federal government of Nigeria has also dedicated additional resources recently. The president has approved additional resources for procurement of test kits and also procurement and antiretroviral drugs that will avert the transmission of mother-to-child transmission and ensure that children also that are infected with HIV are also on the treatment.
All right, Dr. Anas, let's take a break, and when we come back, we'll continue this conversation. Please stay with us, everyone. Welcome back to Politics Tonight, everyone. Thank you very much for staying with us. Dr. Salma Anas, Special Advisor to the President on Health, is my guest tonight as we discuss the theme of this year's World Health Day 2025, Healthy Beginnings, Hopeful Futures. Dr. Anas, thank you very much for staying with us on the program. Before we went on that break, you were talking about weak links and increased funding. And truthfully, I do not know to what extent the impact this has on federal government's efforts at reducing the numbers out there. But state governments have been urged to increase funding for HIV, syphilis, hepatitis programs. Would you say state governors understand that this is a call to action for stakeholders to mobilize resources, strengthen advocacy, and implement sustainable health programs in their respective states?
Yes, thank you so much. They do understand that because we do recognize the gap between the national and also the state government in terms of our mandate, and also working together in terms of operationalization of our policies. So what initially happened under President Bola Ahmed Tinubu, that was done by the Honorable Minister, was signing of the compact by the federal government. You know, all subnational government, they also assigned that compact. And what it means is that they align, they believe that we should work together, and they've aligned to all the aspirations of President Bola Ahmed Tinubu. They've aligned with all the priorities of the government of President Bola Ahmed Tinubu. So all of them have signed and are committed to ensure that we operationalize and realize those commitments. But not all states are not at the same level in terms of operationalization and also demonstrating the commitments. But I can say a lot of states have moved forward and they've demonstrated increased even budgetary allocation for health, especially also budgetary allocation for reproductive health and including maternal, newborn, and child. In some states, they are also procuring even family planning commodities. They have budget lines and they are also already procuring family planning commodities. So a lot of states are doing well. They are not all at the same level, but we continue to do advocacy, which we have been doing to the states to ensure that they fully align, and also with the fund that is being supported from the federal government, BHCF, and also the vulnerable group funds. States are also bringing additional matching funds to ensure that they bridge the gaps and close gaps in terms of achieving the commitments that they have made. So a lot is ongoing, but we continue to ask, we continue to lobby, we continue to advocate for state governors to continue to put in more efforts, more investments, in the health sector, especially now that we are dealing with both communicable, non-communicable diseases, and then most of the issues of maternal, newborn, and child health mostly affect vulnerable women at the lowest level. And then what is another most important is also the creation of the local government autonomy, which has also given another leverage and opportunities to do more intensive awareness creation and ensure that at local government level, there are clear budgetary allocations for health, and then clear budgetary allocations dedicated for maternal, newborn, and child health, including procurement of family planning commodities at that level.
All right, interesting. So let's go back to reducing maternal mortality and morbidity. I really want to know, how does access to skilled birth attendants reduce maternal morbidity?
So skilled birth attendant is very critical because that is a critical moment that is most desirable, that every woman at the point of labor and delivery, she's attended by a skilled birth attendant. And I explained earlier on, skilled birth attendant is any healthcare provider that is well trained, on the conduct of delivery, identifying the risky pregnancy, conduct of a safe delivery, either in a facility at home. We encourage at the moment at facility because we don't have adequate healthcare providers to deliver women at home. So it could be, as I said, a medical doctor, it could be a nurse, a midwife, it could be a community health extension worker that has been trained, or a community health officer that has been trained. But what is most important is at that point, the woman must have in attendant a skilled birth attendant, and which is still what we have been struggling to ensure. From our recent statistics, you've seen that we've not made so much progress in terms of women being delivered by skilled birth attendants. So there is still a huge gap, especially in the northern part of Nigeria compared to the southern part of Nigeria. So a lot of efforts are ongoing in terms of advocacy to ensure that we train more nurses and midwives, we train community health workers, we deploy them to our health facilities. And apart from that, we also make the linkages between our old traditional birth attendants, which we educate and enlighten them to be able to identify risky pregnancy and ensure also that they educate and refer women to be delivered at the health facilities where we have skilled birth attendants. So there's a good correlation between the two. Women that are delivered by skilled birth attendants are most likely to be delivered safely. If there are risky pregnancies, they are most likely to be identified much earlier and referred for further management by a higher level of skilled healthcare provider. So it's quite a big difference. And then a woman that has no access to a skilled birth attendant. So this is very critical, and it's a key pillar in the provision of our healthcare services for women, especially pregnant women, and also for newborn. The newborn also requires skilled birth attendants because a lot of babies, they die at the point of delivery, as a result of asphyxia, lack of oxygen during the delivery. So they could be saved if they are delivered by a skilled birth attendant. And immediately after delivery, a lot of them die within the 24 hours of delivery, a lot of newborn babies. So that's why still in Nigeria, we have very high newborn death. We've not made much progress. In fact, it has increased from 2018 NDHS, the National Demographic Health Survey, from what we saw in 2023. So a lot needs to be done to ensure that women are delivered by skilled birth attendants. Newborns. So
let me take you up on this, Dr. Anas. I'm not sure you've seen that video. There's a trending video of a pregnant woman who died because her husband could not afford an upfront fee of 500,000 naira before the hospital attends to her. How do we, stop these kinds of cases from research?
So what this government is doing, I'm sure you must have seen the program launched by the Minister of Health on emergency ambulance services. Any woman that comes to a health facilities must be attended to as an emergency. You know, you don't ask for payment at that point. The woman must be attended to at every point. And this is something we continue to educate. Even today, I was talking to facilities. When they bring women to facilities, the first thing in some facilities they will ask for, we don't have beds. And we felt bed is a luxury. Bed is a luxury. The first thing is to save life. Whether standing, lying, or sitting, the woman can still deliver a baby. So the most important thing is to save the life of that mother at that point and the baby. So it is unacceptable to say that they have to put down the money before you attend to a woman that is in need. Most of these deaths are preventable. The major causes of the deaths when they come is bleeding. And women will straight away go into shock. Or hypertension, where they come in shock with preeclampsia or postpartum or preeclampsia or eclampsia. So those are the major causes of death. But the bleeding is even on top of all. So how can on earth a healthcare provider who is expected to save life see a woman in pains and bleeding, and then you still insist that you have to collect money? You are not. So we are also working with the National Council to ensure that we also strengthen all the council on the medical and also the nursing council to strengthen and enforce the regulatory measures, you know, that will ensure disciplinary action, because it should not go free. And
because I wanted to
enlighten hospitals and our patients.
So my next question would have
been,
when
hospitals to enlighten our clients and our patients that that all this that we say, it is God that said she's going to die at that point. No, it's your right. It's your right. So there's nothing like it happened. So if it is the date at every health facility, and that is the delay we're also talking on, you come to a facility at that point and then you are not getting the services, either as a result of attitude of healthcare provider or as a result of lack of equipment or facility. It is truly unacceptable. And we are trying to work very hard with civil society organizations to enlighten even the clients, families, communities, and patients to take it up. It's a right issue.
You know, my next question would have been, when hospitals, can you hold on, Dr. Anas? My next question would have been, when hospitals go against these rules, what are the consequences? Do these hospitals know there are consequences for such actions?
There are consequences. You know, we have the Nigerian Medical and Dental Councils. There is also the Nursing Council that regulates licenses. So there are consequences. But one of the major challenges we have, they are not also being reported. So we have to educate Nigerians to understand that there are consequences, there are disciplinary actions that are taken. So no woman should die upon arrival at a facility due to lack of access to services or inability to pay. It's truly unacceptable. And this is where also working to enforce that actions are being taken.
All right. So let's go back to preventing mother-to-child transmission of HIV. I would like to know, how does the timely use of antiretroviral therapy during pregnancy reduce the risk of HIV transmission to the baby?
So this is something we started in Nigeria, and I was opportune to be part of that. It's since 1999. We started it fully in 2001 by establishing it at Excellence. You know, evidence have shown that the use of antiretroviral drugs in women with HIV infection will reduce transmission by more than 90%. And now it is even much better, because once the woman takes the drugs, once she's detected with HIV infection, she's enrolled on antiretroviral therapy throughout pregnancy. And that drastically reduced transmission. And after that, we also talk about the breastfeeding, because at that point, if a woman is known to be HIV positive, there is no need to breastfeed the baby. So she's been educated on alternative breastfeeding, and that is when it is medically prescribed. It is medically prescribed for her to feed the baby with alternative baby food. So you now prescribe and they initiate alternative baby food. And we've had a lot of cohorts of children that have been delivered by mothers that are HIV infected, that are not HIV infected. So we continue, but you know, just like I said much earlier, the backbone of it, the entry point, is to ensure that all women that are pregnant enrolled in any antenatal clinic nearest to them, so that they will know their status as part of all the screening, including hepatitis screening, syphilis screening, including even malaria screening, knowing your blood group. Those are the things we do to ensure that we understand the medical picture, the medical situation of every pregnant woman, so that she can also be managed appropriately, you know, enhance her health so that her immunity does not drop, and also at the same time take care of the baby in utero, so that you have a healthy baby. And these are all part of the beginning that this World Health Day is focusing on. Healthy beginning, you know, and hopeful future. Because if you don't do that, you don't detect the diseases, you can have a baby with deformities, you know, disabilities, several other things, either affecting the eyes, the ears, the brain, and whatever. And then you deliver a child that is disabled. So it's very important that we educate. I think education is very important. We need to step up. We are working hard. We need to step up our education of families, of communities, to ensure that every pregnant woman attend antenatal clinic. Because a lot, when I work with communities, do not understand the benefits of attending ANC. So it's not just about the delivery, it's also about accessing antenatal care and knowing your medical status. And if there are problems detected, they will be promptly addressed very early.
All right, Dr. Anas, I would like to take you up on the prevalence of counterfeit drugs and what the federal government is doing to reduce this to the barest minimum. But before that, my final question on this is, what role do community health workers and peer support networks play in reducing mother-to-child HIV transmission rates?
The community health workers, they have a very critical role to play in reducing HIV transmission. Because first, if you look at the key component of HIV scope in terms of control, is prevention. Prevention is very significant. So they play a role in educating our communities and then creating awareness on how to prevent the transmission of HIV. You know, not only through mother-to-child transmission, but also sexual transmission, which is the major one, transmission of HIV, and also transmission through other practices that we do, such as contamination, or either using a barber salon, cutting of our nails, blood transfusion, and several others. So they are part of the frontline healthcare providers. They are volunteers also. They can also be volunteers in communities that will be educated, that we build their capacities, and they continue to scale up at that community level. So apart from that, they play a key role, of course, in antenatal care. They play a key role in the delivery of babies, in immunization activities, in also nutritional monitoring and advising on the right nutrition to feed both mother and also the baby. You know, there's what we call the baby clinics in our health facilities, mostly run by community health extension workers, where they weigh the baby frequently and also monitor early detection of severe acute malnutrition. So they play a key role in early detection of such, and also continuation of treatment. So they are very significant, and they are, I can say they are also a backbone of the healthcare delivery in our country.
Right, but is the federal government doing its own part in training and retraining of those public health workers?
Yes, so the training is all encompassing. It's not only limited to healthcare providers that are working in public health facilities, but is expected to cover including private health sectors, especially in Nigeria, where we have a very significant healthcare private sectors providing healthcare services in our country. You know, whether formal or informal, we can't do away with that at the moment. People pay out of pocket, but we want to make sure that we regulate and ensure that the practices are standardized, so they are all captured in all the trainings that are being done for healthcare providers, be it either you are in a private or a public health facilities.
All right, Dr. Anas. So let me take you up on other matters. We have about 3 minutes to go tonight. I want you to talk to us about, Nigeria's counterfeit drug epidemic, the impact of fake drugs on the health of Nigerians. Stakeholders in the drug supply chain and pharmacists say In recent years, they've had to double their verification on the authenticity of medical products. Why is this so, and how can we see an end to this scourge?
So, yeah, thank you so much. And I must commend the efforts of our NAFDAC DG. She's doing a wonderful job in trying to ensure that we deal with the issues of counterfeit drugs in Nigeria. It's very hard, it's very difficult, but I think a lot of efforts she has put in it, and it's yielding results. And then first it starts, as I said earlier, is empowerment of our communities. We must understand the regulations. We must understand what we meant by counterfeit drugs. And so that everybody will be like a watchdog in your own community and understand what are expiry drugs. Even expired drugs are being sold, you know, in our open market. So all those, we need to have a common understanding. It's a joint effort, and we have to report appropriately. So NAFDAC is there as a regulatory agency, and then they register drugs, and then they have all the numbers and the regulations that are inscribed on all drugs that are supposed to be taken. So awareness creation is ongoing to enlighten Nigerians so that they understand. Because it's very dangerous. It's better not to take the drug if it is not a drug that has been of standards and has been approved and have met the requirements as approved by NAFDAC, because it can lead to a lot of complications, reactions. It can lead to ill health. It can destroy even your organs, liver, kidneys, you know, and so on. And then subsequently, it can cause death. So I encourage all Nigerians to work together and encourage and support the regulatory agencies, and also to report, you know, just like the police advertise. You have to see something, say something, and then report. I think that's it's a joint responsibility of everyone. We have to shine our eyes and see what is happening in our communities. If you have a pharmacist or a chemist in your community, you have to shine your eyes and ensure that they are selling standard drugs or in a health facilities, so that community, individual citizens are not victims. And I continue to support Madam NAFDAC, my sister, for the good work she is doing in NAFDAC.
All right, Dr. Anas, thank you so much for speaking with us tonight on Politics Tonight. It was important for us to have this conversation. Most importantly, hearing you talk about the level of progress made in reducing maternal and neonatal mortality. Thank you so much for joining us tonight. Dr. Salma Anas is a special advisor to the President on health. Thank you so much for your time.
Thank you so much.
Thank you very much for watching, everyone. That marks the end of today's episode of Politics Tonight. But before we go, let's tell you that the views and reactions of our resource persons are theirs and have no connection with TVC News. Meanwhile, you can watch the repeat broadcast of this episode at midnight. Get in touch with us on our social media handles, Facebook, Instagram, and X at TVC News NG and at Olajumoke using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News Nigeria. I am Olajumoke Olatunji. Good night, everyone.